Okay, so hi everyone. We are PB and J, and today we're talking about our project, which is reducing risk-taking behavior in adolescents in poverty, short for Rrtbap. So my name is Palace or Ting Wei. So I'm going to talk about the statement of need for our project, which is talking about the population that we're wanting to target it with. So as you can see from our project name, we want to target it on children who are living in poverty. So as research suggests that poverty has increased children's risk in their environment, and in Dallas County, out of every 4.6 families live in poverty. So it has been a serious situation in our neighborhood, and for children who live in poverty, they are more exposed to chaotic living situation and have less access to healthy food, and they are exposed to more crime and toxins. So poverty is pretty harmful in dealing with their psychological well-being, and they will also increase their possibility of getting aggression, anxiety, depression. And specifically, we also want to emphasize that poverty is harmful by damaging stress regulatory mechanism because of the environmental risk that they experience repeatedly throughout their childhood. So these persistently stressed children are very vulnerable to difficulties in learning how to effectively regulate their thoughts, their emotions, and their behaviors. And as you can see from our topics, we want to focus on adolescents from low SES environment. These adolescents have experienced violence exposure, that has been associated with increased depressive symptoms, anxiety, and externalizing problem behavior, and which is what we want to focus on to reduce their risk-taking behavior. So we are going to partner with the Boys and Girls Club of America, short for BGCA. And Boys and Girls Club of America have provided youth with a safe place to learn how to learn and grow by offering them life-enhancing programs. These programs include in 5 core areas that they emphasize on. One is character of leadership development, education and career development, health and life skills, art, and sports, fitness, recreations. But in these 5 core areas that they emphasize on, there's no program that addresses the issue of stress dysregulation in youth, and which, according to research, is associated with their risk-taking behaviors. So our target population is going to be adolescents at the age of 13 to 18 from low SES families and who are already attending the Boys and Girls Club. And since we're focusing on the Dallas area, we're going to partner with the Boys and Girls Club of Greater Dallas. So our project is to have the goal to improve these adolescents' mental, behavior, and emotional health in general.
Okay, so just based off of research that we've read over in preparation for our project, there's a couple that really stuck out to us about that were really important in forming our program. So the first one's by Young et al. It's talking about how group counseling has been shown to have beneficial long-term outcomes and overall functioning. This was in comparison to groups who were doing more interpersonal or just individual. The second one is about cocaine and alcohol cravings. And so cocaine and alcohol cravings were observed with stress and drug cues imagery, but not with neutral relaxing imagery. So what this means is when participants were shown a stress, something that was supposed to induce some stress in them, they were more likely to crave cocaine and alcohol. And then this third one is drug and alcohol use is a big factor in sexual risk-taking behaviors. So those bottom two kind of like stack onto each other. So that stress, it induces some like alcohol cravings, and those alcohols and drug usage is a big factor in those sexual risk-taking behaviors. So knowing all of that information, we've wanted our participants to engage in CBT-based group therapy for 36 weeks to reduce stress, which in turn would reduce that drug and alcohol usage, which in turn would reduce those sexual risky behaviors. Throughout the 36 weeks, participants are going to be engaging in expressive arts therapies, which has been shown useful by Ziff, Nibers, and Shaw. And then throughout those 36 weeks, we'll kind of go into more detail about them, but the first 18th and 36th week, participants are going to participate in most, if not all of these. The revised children's manifest anxiety scale, the social connectedness scale, child and adolescent needs and strengths, the things I do, and fingertip thermometer for biofeedback. And again, those will go into more detail about what exactly they're measuring in a little while. So this is our logic model, and just to reiterate, that situation we're looking at is the higher prevalence of stress and anxiety in the childhood population experiencing poverty. And so that's the big overarching problem that we're looking at. Some priorities, though, like we want to, for children in poverty, we want to decrease those risk-taking behaviors. So to kind of go over some of our goals we have, because we'll talk about the inputs and outputs here in a little bit as well. So some of the short-term goals, we're going to be looking at self-awareness of stress and anxiety behavior stressors. We're going to be looking at social connectedness in adolescents. And then we just want to have a lot of attendance for our program to work. And then just kind of those middle term results, we want to decrease some RCMAS scores. We want to decrease those the fingertip biofeedback, FTB stress scores, and decrease anxiety and stress. And then long term, we're going to want to look at the drug usage and those risky sexual behaviors, and we want to decrease those by 12.5% based off of their initial, their baseline data that we'll gather from them. Alright, and so throughout those 36 weeks, we're going to have the counselors are going to focus in on topics that they're just going to kind of facilitate conversation around those topics. So some of those topics are poverty, stress, drug usage, social interactions, and then managing risk-taking behaviors. And in between each week, we're going to do an expressive arts therapy week. So it'll go poverty, expressive, stress, expressive, drug use is expressive, and so forth and so on. And we're going to kind of cycle through that through those 36 weeks. Again, really trying to get at lowering that stress, lowering that drug usage, lowering those, or increasing the ability to manage those risk-taking behaviors, and then increasing our social interactiveness, and then just the conversation about how poverty and how being in those low SES communities are affecting them. So counseling relationships are obviously important. Christoph, Johnson, Gibbons, and Gallup, they did a study where they found that the positive relationship between the client and the counselor is associated with less days of cocaine usage. So that better that relationship is, the less likely they are to be using cocaine. They're going to have less days of using. And then with that established positive alliance, clients are more likely to engage in behaviors that model a 12-step program. So that relationship is really key. Another thing this article points out is the fact that you don't want to give advice statements. You want to kind of, because you don't want to be told what to do in these situations. You want to be heard and listened to. So just that basic counseling foundation, that relationship is really important to our clients here. And it's just something to keep in mind. So barriers that we can anticipate having are participants and clients skipping sessions, lack of participation within the sessions, obtaining consent for minors, and language barriers. So those bottom two, those last two, we'll go over those in a little bit more detail later. But as far as participants skipping sessions and then having a lack of participation within sessions, it's really going to be based on the counselors. We want them, or for the skipping sessions, we're going to really emphasize to those clients the importance of being in our sessions and building those relationships. And then that lack of participation is going to be on those counselors to kind of really facilitate those relationships and also build more and form good foundational relationships. So, thank you.
Hey, I'm gonna quickly hop in. I'm Amy. I'm gonna quickly hop in just for this timeline. So this is 2019, 2020. We just did this as an example of what our timeline would be like. We know that the grant that we're applying for may not be that quick of a turnaround, since we're already, at the end of July. But anyway, how we're gonna do this is the program director is going to have flyers posted at the Boys and Girls Club to initiate people wanting to be a part of our group and get the interest out there. So the program director is going to be responsible for that. And then we're going to have the orientation where the informed consent and we'll discuss the goals of our group and answer any questions that either the adolescents or maybe their parents wanted to ask questions as well. We'll be able to have a space for that. Then going into week 1, the counselors will be administering the assessments of the CANS, the RCMAS, Things I Do, and Social Connectedness Scale. This will be prior to starting the group, so we have that baseline of where the clients were at the beginning, so we can assess later on how we improved. We were able to help their scores. Then about week 18, the counselors will administer assessments again. The only difference is that we will not assess for the CANS in the middle of the program. So we'll be doing RCMAS, Things I Do, Social Connectedness Scale. Okay. Then the counselors will, with the program director, will be comparing the data from the pre-test, and then counselors should throughout the program be assessing and just ensuring that the paperwork is up to date, but this is another time that we have set in that all paperwork and case notes are up to date. And then towards the end, week 36, our last session, counselors will again complete these assessments, all of them including the CANS, so we can have that data. All client files will be collected, so we can again have that comparison, including the fingertip thermometer biofeedback that happens at the beginning and end of every session. So all of that will be compiled, and the exit interviews we will have just to make sure that the participants have an opportunity to tell us where we could improve, as well as if parents again want to participate in that, they can let us know, and then the counselors and program director will also collaborate to see where we can improve on that. All right, that's our timeline.
I'm Ashley, and I'm going to talk a little bit about our team. So we have the Boys and Girls Club director, and they're going to act as a liaison for the project director and for Boys and Girls Club. And then we're going to have 3 LPCs as well. So for the project director, they're responsible for hiring the 3 LPCs and will, like I said, act as a liaison with the Boys and Girls Club director. And they will work to find the adolescents for to participate in our project, and they will set up times for the session that work with all of our participants and their schedules, and they will ensure that the informed consent forms are signed by parents, and they will hold weekly meetings with the LPCs to evaluate progress and discuss improvements. And they must be dedicated and committed to helping the youth, and they must be experienced in overseeing projects and administering functioning. Counselors, each counselor will facilitate 2 groups per week, administer and score the assessments given at week 1, 18, and 36. They will also facilitate the use of the fingertip thermometer before and after every session and compare those results. And they will also set up the counseling rooms for group specifications and clean up afterwards. and they will complete and maintain detailed session notes. They also must be active in improvement and optimization process for creating the program, and they must maintain a cultural approach to counseling and have experience working with this population. So for multicultural counseling, we do have 2 bilingual counselors, allowing room for 4 out of 6 of our sessions to be in Spanish if needed. And due to working with a variety of races and ethnicities, we have built discussions surrounding race into our sessions. All counselors will have obtained multicultural education to provide culturally sensitive counseling skills, as well as experience in group counseling with different cultural considerations. These requirements will allow us to provide multicultural counseling to our clients.
I am Jacy, and I'm going to be talking about our evaluation processes. So first I wanted to talk about the fingertip stress thermometer that we've been talking about, and then how that connects the summative evaluation. We want to make sure that everything that we are evaluating and recording has to do with our goals. So the fingertip thermometer affects or it measures stress short term, and I have different references here that all talk about the different things that all connect and in risky behaviors, sexual risky behaviors, drug use, and so all of these different scales are going to measure the things that will result in the risky behaviors that we're talking about. So stress and anxiety is one of them, and this stress thermometer is something that can easily be used before and after every session, and once the kids know how to use it, they can just do it themselves. You just hold it and then report to the counselor, and it'll become like a really fast thing. They'll look forward to doing it and just report it to the counselor, who can record it. And then we will have evidence that the actual group counseling is helping. And our goal with that is to, by session 1, maybe they're anxious, and so they're going to have the more tense. Like the lower the temperatures, the more stressed and tense they are. And then once you're higher, like 95 degrees on here, that will show that the children are more relaxed. So our goal is that maybe at the beginning they even start with more tense hands, but then by the end they'll start more relaxed. And then that, along with the fact that hopefully before and after session they will be more relaxed by the end. So that also has to do with the anxiety scale that we're talking about, that the anxiety scale is going to connect to that same risky behavior. And then social connectedness has been linked to like poor choices and poor decision making that result in the risky behaviors. So that's another part of our project, that we're hoping that the connectedness of the project itself and the kids that they'll meet and the adults that they'll have relationships with will hopefully improve their decision making. And then the CANs and the things I do both have to do with the actual risk-taking behaviors, so that we can have all of that information and be able to look at that, and hopefully that as anxiety goes down, so do the risk-taking behaviors that we're trying to measure. And then as this is like the beta test for like the first one will be here, and then we can use this as a model to spread across to other Boys and Girls Clubs. We want to figure out how to make it better and how to optimize what we're doing here. And how we're going to try and do that. First, we want all of the scores so that we can have the empirical evidence to prove that we are affecting the goals that we say we are. And then we've talked about the project director is going to have weekly meetings with the counselors. And that's why it's very important that the project director is somebody who is willing to like listen to change and listen to suggestions. That those meetings are, the focus of them is to make the project better and to say what's working and what's not, what our strengths, where could we improve. And then participant feedback will hopefully happen all throughout the project. And the counselors will constantly be talking to the parents and the children, and that they'll be able to tell what's working and what's not. But especially near the end, the terminations, which is the last sessions with the groups, they will process with the children, okay, so, what goals did we meet? What goals did we not? What worked? What didn't? And that's going to inform the counselors a lot on what worked and what didn't, so that they can tell the project director. And then exit interviews, which we mentioned earlier, where we're going to talk to the parents and the participants themselves and the counselors, and really figure out, like, okay, what needs to change, how can we make this better, what can we do to optimize the program that we're using now, and create a model that can be used in other big girl cases, boys and girls clubs.
Okay, now for the budget. What we are asking you, what are all the things that we're asking money for? So, going into our first year, we are going to be collaborating with Boys and Girls Clubs, like we said. So we will have the physical space, tables and chairs, and art materials supplied by the Boys and Girls Club. So we did not need to put that into our budget. We do need a good amount of funding in order to have our program. The total here is $107,864 that we were requesting from the Community Prevention and Early Intervention Grant. So if you look at our first year expenses, I just wanted you to see the biggest expense that we are having is good quality counselors. They're going to be working at other agencies, and we're going to be contracting them. So we want to make sure that they are paid well for their traveling time, being able to lead these sessions, and with enough time to complete session notes as well. And so the total is $71,280. That is for 3 counselors, which is 66% of our budget. And that is because we're estimating that they're going to be paid about $150 per hour and $60 per week for travel. And we mentioned earlier that each counselor will be leading 2 groups per week. It will be on that same day, whichever day that works best for Boys and Girls Club and that the program director decides. So they'll be working 4 hours each week. And with 75-minute group sessions for the adolescent boys and adolescent girls, and 90 minutes for room preparation, cleanup, and note-taking. So each counselor will be paid $660 per week for 36 weeks, and when you multiply that out, it's again the $71,280. So the next biggest chunk is our program director. This is a part-time job, up to 29 hours per week, and that will be paid $35,000. And then both the assessments and snacks are just 1% of our budget. But we want to make sure that those are taken care of as well. So we have the CANS assessment, the RCMAS, Things I Do, Social Connected Scale Revise, and the FTV. So let me go into detail on the next page so you understand. The Things I Do and Social Connectedness Scale Revised, we were able to access for free, so we do not have that included in our budget. The CANS assessment, for our 3 counselors, they need to be trained in CANS, which will be $10 per year. And the actual assessment itself, we can be found on the Parade Foundation website for free. Then the RCMAS costs $146 per kit, which includes the manual, 25 forms, and 1 audio CD. We'll need 3 kits per counselor, so that will total $438. And then because we're giving the RCMS on 3 different occasions, the pre, middle, and post, we are going to need additional 3 packets, which is $25 per pack, which is $59 per pack. So the total cost for the RCMS, when you add all that up, is $615 for the first year. Then the fingerprint thermometer for biofeedback, which is the FTV right here, they're $25 per unit, like the one we showed you. So that's a total of $75 per year. So the total cost for assessments when you add the RCMAS, the CANS, and the FTV, because again the other ones are free, is $720. And then we're going to go into snacks. So that's the second smallest part of our budget, which is total is $864, because we're estimating 50 cents per snack for 48 adolescents for 36 weeks. So again, the total expenses that we are requesting from the Community Prevention and Intervention Grant is $107,864. And I plan to have a balanced budget and make sure that we have no outstanding expenses due. So our 3-year projected financial plan for our program of Rrtbap. So year 1, we're planning to have that grant, because you guys are so generous and we thank you so much. We're going to have that full coverage taken care of, and we are assuming our next 2 years will stay the same unless we hear feedback after the first year that we need to readjust things. So again, it'll be $107,864 each year, and we're going to have everything zero out, so we don't owe anything. Everything's taken care of. Thank you guys. This is the Rrtbap project proposal, and we thank you for your attention.